Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing infectious disease and disorders. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 28-year-old female patient with HIV presents with fever, dry cough, and shortness of breath. Chest X-ray shows bilateral interstitial infiltrates. The provider suspects Pneumocystis jirovecii pneumonia, PJP. What should the nurse anticipate doing first? A. Prepare the patient for chest physiotherapy. B. Initiate airborne precautions. C. Obtain a sputum sample for staining and culture. D. Administer high-dose corticosteroids. Correct answer, C. Rationale. Obtaining a sputum sample is crucial for confirming the diagnosis of PJP. This diagnostic step guides antimicrobial therapy. How it helps. Early identification of the organism helps guide treatment and prevents complications. Question 2. A 70-year-old man with diabetes presents with cellulitis on the right leg. His temperature is 101.8 degrees Fahrenheit, 38.8 degrees Celsius, WBC is 18,000, and heart rate is 108 beats per minute. Which nursing intervention takes priority? A. Apply warm compresses to the area. B. Elevate the affected leg above heart level. C. Administer antipyretics. D. Mark the erythema border for monitoring spread. Correct answer, B. Rationale. Elevation helps reduce swelling and promotes venous return, preventing further spread of infection and improving perfusion. How it helps. Reduces inflammation and promotes healing while awaiting antibiotic effect. Question 3. A patient with Clostridioides difficile infection, CDI, is experiencing 10 watery stools per day. Which of the following should the nurse implement? A. Insert an indwelling urinary catheter. B. Administer diphenoxylate atropine for diarrhea control. C. Place the patient on contact precautions. D. Encourage high-fiber diet and increase activity. Correct answer, C. Rationale. Contact precautions are essential to prevent the spread of C. difficile spores, which are highly contagious and resistant to alcohol-based hand sanitizers. How it helps. Protects other patients and staff from infection and promotes infection control compliance. Question 4. A patient with a recent diagnosis of meningococcal meningitis is admitted to the unit. Which intervention is most appropriate for the nurse to perform first? A. Elevate the head of the bed 30 degrees. B. Administer antipyretics. C. Initiate droplet precautions. D. Monitor neurologic status hourly. Correct answer, C. Rationale. Meningococcal meningitis spreads via respiratory droplets. Implementing droplet precautions immediately is essential to protect others. What to do instead? If the nurse doesn't initiate isolation, cross-contamination could occur rapidly, endangering others. Question 5. A 45-year-old patient being treated for tuberculosis, TB, complains of orange-colored urine. What is the nurse's best response? A. Notify the healthcare provider immediately. B. Encourage the patient to increase fluid intake. C. Instruct the patient this is an expected side effect of rifampin. D. Stop the medication and assess for hepatotoxicity. Correct answer, C. Rationale. Rifampin causes orange discoloration of body fluids, including urine and tears. This is a benign and expected effect. How it helps. Reassures the patient, promotes adherence to treatment, and avoids unnecessary alarm. Question 6. A neutropenic cancer patient develops a fever of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. What is the nurse's priority action? A. Check the patient's most recent WBC count. B. Notify the provider and prepare to draw blood cultures. C. Administer acetaminophen and reassess in 1 hour. D. Monitor for signs of bleeding. Correct answer, B. Rationale. In neutropenic patients, even a mild fever can indicate a serious infection. Blood cultures should be drawn promptly, and broad-spectrum antibiotics started. How it helps. Early intervention prevents progression to sepsis in immunocompromised patients. Question 7. A nurse is caring for a patient with suspected infective endocarditis. Which finding requires immediate intervention? A. Splinter hemorrhages on fingernails. B. Temperature of 100.6 degrees Fahrenheit 38.1 degrees Celsius. C. Sudden confusion and restlessness. D. Raw spots observed in the eyes. Correct answer, C. Rationale. Sudden confusion may indicate embolic complications, such as a stroke, which is a life-threatening emergency associated with infective endocarditis. How it helps. Rapid recognition prevents permanent neurological damage or death. Question 8. A 30-year-old patient presents with fever, rash, and hypotension. The patient recently had nasal packing for epistaxis. Which condition should the nurse suspect? A. Septic shock from endocarditis. B. Toxic shock syndrome. C. Meningococcemia. D. Anaphylactic reaction to latex. Correct answer, B. Rationale. Toxic shock syndrome can result from retained nasal packing or tampons, with fever, rash, and hypotension being hallmark signs. How it helps. Prompts early provider notification, discontinuation of source, and fluid resuscitation. Question 9. A patient is admitted with necrotizing fasciitis in the left thigh. Which of the following nursing actions is most critical? A. Apply heat packs to reduce pain. B. Prepare the patient for emergency surgical debridement. C. Administer oral antibiotics as ordered. D. Massage surrounding tissue to promote circulation. Correct answer, B. Rationale. Necrotizing fasciitis is a rapidly progressing soft tissue infection requiring emergency surgical debridement to prevent systemic spread and death. Delay can be fatal. Question 10. A nurse is caring for a 34-year-old returning traveler with fever, chills, myalgia, and a history of mosquito bites in Africa. Labs show thrombocytopenia and elevated liver enzymes. What should the nurse anticipate? A. Initiating reverse isolation. B. Preparing for malaria testing. C. Administering IV corticosteroids. D. Encouraging increased protein intake. Correct answer, B. Rationale. Travel history and symptoms suggest malaria. Testing for Plasmodium parasites is the appropriate next step to confirm the diagnosis. How it helps. Guides timely treatment and helps prevent complications like cerebral malaria. Question 11. A 68-year-old male with a recent hip replacement presents with chills, malaise, and a temperature of 102.5 degrees Fahrenheit 39.2 degrees Celsius. The surgical site is warm, swollen, and draining purulent fluid. What should the nurse do first? A. Remove the surgical dressing and cleanse with chlorhexidine. B. Elevate the affected leg above heart level. C. Obtain a wound culture using sterile technique. D. Administer IV ceftriaxone as ordered. Correct answer, C. Rationale. Wound cultures should be obtained before initiating antibiotics to accurately identify the causative organism and guide therapy. Administering antibiotics first may alter culture results. Question 12. A patient diagnosed with severe sepsis is receiving IV fluids and broad-spectrum antibiotics. The nurse notes decreasing urine output, 20 milliliters per hour, tachycardia, and cool extremities. What is the priority nursing action? A. Notify the healthcare provider about the low urine output. B. Administer a prescribed diuretic. C. Increase the IV fluid rate per protocol. D. Prepare to insert a central line. Correct answer, A. Rationale. Decreased urine output is a sign of poor perfusion and potential progression to septic shock. The provider should be notified promptly for potential interventions like vasopressors or fluid adjustments. Question 13. A nurse is caring for a patient with hepatitis A. The patient is experiencing nausea, fatigue, and mild jaundice. Which intervention should be prioritized? A. Administer acetaminophen for discomfort. B. Educate the patient on alcohol avoidance. C. Encourage small, frequent high-protein meals. D. Initiate standard precautions. Correct answer, D. Rationale: hepatitis A is transmitted via the fecal-oral route. Standard precautions, including strict hand hygiene, are essential to prevent the spread of the virus. Question 14. A patient with bacterial meningitis is receiving IV antibiotics. The nurse notes that the patient's Glasgow Coma Scale, GCS, score has dropped from 13 to 9. What is the nurse's priority action? A. Reassess GCS in 15 minutes. B. Prepare the patient for a lumbar puncture. C. Elevate the head of the bed to 30 degrees. D. Notify the healthcare provider immediately. Correct answer, D. Rationale: a significant decrease in GCS indicates potential increased intracranial pressure or worsening neurological function and requires immediate provider notification to prevent further deterioration. Question 15. A 29-year-old patient presents with fever, productive cough, pleuritic chest pain, and crackles in the right lower lobe. What is the nurse's priority action? A. Encourage incentive spirometry use every hour. B. Obtain a sputum sample for culture. C. Administer prescribed albuterol nebulizer. D. Start IV fluids for hydration. Correct answer, B. Rationale: a sputum culture should be obtained before initiating or continuing antibiotic therapy to ensure proper identification of the infectious organism. Question 16. A patient with infectious mononucleosis is found to have splenomegaly. Which activity should the nurse instruct the patient to avoid? A. Low-fat diet. B. Alcohol consumption. C. Contact sports. D. Deep breathing exercises. Correct answer, C. Rationale: patients with splenomegaly are at increased risk for splenic rupture. Contact sports should be avoided until the spleen returns to normal size. Question 17. A patient with active pulmonary tuberculosis is admitted to the hospital. What action should the nurse take first? A. Start a high-calorie diet to combat weight loss. B. Schedule a bronchoscopy to confirm diagnosis. C. Initiate airborne isolation precautions. D. Notify the public health department. Correct answer, C. Rationale: airborne isolation precautions, including placement in a negative pressure room and N95 respirator use, should be initiated immediately upon suspicion of active TB to prevent transmission. Question 18. A patient with infective endocarditis is being monitored for complications. Which finding is most concerning? A. Petechiae on the chest. B. Fatigue and malaise. C. Janeway lesions on palms. D. New onset hemiparesis and slurred speech. Correct answer, D. Rationale: neurological changes such as hemiparesis and slurred speech may indicate an embolic stroke, a serious complication of infective endocarditis requiring immediate medical intervention. Question 19. A nurse is reviewing discharge instructions with a patient treated for Lyme disease. Which statement indicates the need for further teaching? A. I should complete all of my antibiotics. B. I can stop checking for ticks now that treatment is done. C. I need to report any new joint pain or rash. D. I'll wear long sleeves when hiking in wooded areas. Correct answer, B. Rationale: patients should continue tick prevention measures even after treatment, as reinfection is possible. Believing otherwise indicates a knowledge gap. Question 20. A nurse is caring for a patient with newly diagnosed syphilis. The patient expresses concern about transmitting it to their partner. What should the nurse prioritize? A. Reassure the patient that antibiotics will cure the infection. B. Discuss the importance of partner notification and treatment. C. Instruct the patient to avoid spicy foods during treatment. D. Explain that symptoms usually resolve on their own. Correct answer, B. Rationale: partner notification and treatment are essential to prevent reinfection and further transmission. The nurse should prioritize public health education in this situation. Question 21. A patient with suspected Ebola virus disease arrives in the emergency department. Which nursing action should be performed first? A. Draw blood samples using standard precautions. B. Notify the CDC and Public Health Department. C. Place the patient in a private room with strict isolation. D. Administer IV fluids and antipyretics. Correct answer, C. Rationale: Ebola is a highly contagious viral hemorrhagic fever. Immediate isolation using contact, droplet, and airborne precautions is the priority to protect healthcare workers and others from transmission. Question 22. A patient receiving IV acyclovir for herpes simplex virus develops lethargy and a creatinine level of 2.3 mg per deciliter. What should the nurse do next? A. Monitor the patient for increased intracranial pressure. B. Slow the infusion and increase IV fluids. C. Administer acetaminophen and continue infusion. D. Apply cool compresses to lesions. Correct answer, B. Rationale: acyclovir is nephrotoxic, especially if not well hydrated. Slowing the infusion and increasing fluids can help reduce renal toxicity and improve drug clearance. Question 23. A 36-year-old woman presents with a painless genital ulcer and bilateral lymphadenopathy. Which of the following interventions is the nurse's priority? A. Prepare for antiviral therapy. B. Initiate airborne precautions. C. Educate about partner notification and STI testing. D. Schedule a pelvic ultrasound. Correct answer, C. Rationale: the symptoms indicate primary syphilis. Partner notification, testing, and treatment are essential public health responsibilities to prevent further spread. Question 24. A patient with varicella, chickenpox, reports itching and fever. Which of the following should the nurse implement? A. Apply topical corticosteroids to open lesions. B. Keep the patient in a negative pressure room. C. Administer aspirin for fever control. D. Encourage daily baths with loofah to remove scabs. Correct answer, B. Rationale: chickenpox is airborne and requires negative pressure isolation to prevent transmission. Aspirin is contraindicated due to risk of Reye syndrome in viral infections. Question 25. A patient with MRSA pneumonia is receiving IV vancomycin. The nurse notes the patient's trough level is 24 micrograms per ml. What is the most appropriate action? A. Continue the current dose and monitor for improvement. B. Notify the healthcare provider about the elevated trough. C. Increase fluid intake to dilute the medication. D. Administer diphenhydramine to prevent red man syndrome. Correct answer, B. Rationale: a trough level above 20 micrograms per ml is considered toxic and increases the risk of nephrotoxicity and ototoxicity. The nurse must notify the provider to adjust the dose. Question 26. A nurse is caring for a patient with cytomegalovirus, CMV, infection who is immunocompromised. What is the best precaution to implement? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Reverse isolation. Correct answer, B. Rationale: CMV is primarily spread through direct contact with bodily fluids. Contact precautions help prevent transmission, especially in immunosuppressed patients. Question 27. A patient presents with fever, myalgia, and a bullseye rash after a camping trip. What action should the nurse anticipate? A. Start doxycycline as prescribed. B. Administer tetanus booster. C. Prepare the patient for lumbar puncture. D. Apply antifungal cream to rash. Correct answer, A. Rationale: a bullseye rash, erythema migrans, is diagnostic for early Lyme disease. Doxycycline is the first-line treatment to prevent systemic complications. Question 28. A nurse is caring for a patient diagnosed with hepatitis C. Which statement by the patient indicates understanding of transmission precautions? A. I'll be sure not to share toothbrushes or razors with others. B. I must avoid contact sports until my liver enzymes normalize. C. I'll need to use a face mask to avoid spreading the virus. D. I should avoid eating raw vegetables during treatment. Correct answer, A. Rationale: hepatitis C is bloodborne. Sharing razors or toothbrushes may expose others to infected blood. The virus is not spread through respiratory or food routes. Question 29. A 78-year-old patient with urinary tract infection becomes confused and agitated. Vitals: blood pressure 94/56, heart rate 110, temperature 100.9 degrees Fahrenheit 38.3 degrees Celsius, respiration rate 22. What should the nurse do first? A. Place the patient on fall precautions. B. Initiate sepsis protocol and notify provider. C. Reorient the patient and provide calm environment. D. Obtain an order for bladder irrigation. Correct answer, B. Rationale: in elderly patients, confusion may be an early sign of sepsis. Prompt initiation of sepsis protocol is crucial to prevent rapid deterioration. Question 30. A nurse is caring for a 4-year-old with pertussis, whooping cough. What is the most important action? A. Administer antitussives to reduce coughing. B. Monitor for signs of airway obstruction. C. Provide toys to reduce agitation. D. Encourage oral fluids every 30 minutes. Correct answer, B. Rationale: pertussis causes violent coughing spells that can lead to airway obstruction in children. Monitoring airway status is a top priority to prevent respiratory failure.